Hello, hello.
Look at that. We nailed it. We did
I
it.
know. This is my first time doing a dual live, so this is great.
Well, welcome to the world.
Yeah, this is
This
awesome.
is my second time, so I'm very official and good at it.
Well, I have to learn
Oh,
sometime. So,
we
well, maybe,
so good
okay,
at
we take that back.
it. So good at
Do you
it.
have your pelvis? Do you have your pelvis model?
I never travel
Yes.
without it. I honestly, I'm thinking about getting a second one. I think I need one for home too, because this has
Okay.
happened twice now, where like on a snow day where I needed it at home, and honestly, I wish I just had it all the time. It should really just live in my apartment, but I also needed it at work, so.
Well, I still remember when you showed it to me, because keep in mind, I've looked at countless anatomy books over the years, and
Mhm.
it was just so nice to have a three-dimensional model.
Yeah. Oh, it makes a huge difference.
Oh my gosh. Yeah, it was awesome. All right. Well, we still need to name it
The
too.
model. I know.
Yeah.
It needs to be gender neutral. So that's
Yeah.
kind of the requirement.
All right, we can do that. We can figure it out. Awesome.
Yeah. How's it going?
Well, good. Yeah,
Yeah.
good. I've been thinking about this all day and just kind of like thinking about questions and like how to formulate the story, and I don't know, hopefully it'll kind of add some clarity for people who have been curious about pelvic PT work and maybe are hesitant. So yeah, hopefully it'll add a little bit more clarity to everything.
Yeah, I think that's great. So I think it would be great to start with just why you sought out pelvic PT in the first place, what was going on.
Yeah, definitely. So I'm 40 years old, and I may act like I'm 12 sometimes, but I'm 40 years old, and I didn't necessarily have any issues like for as a CrossFit athlete and as a bodybuilding, weightlifting, powerlifting type of. I just like to sling weights. As that type of athlete, as well as mountain biker, being 40, freshly 40, I guess I was just a little bit concerned. Like I wanted a little bit of a check-in. And I was already thinking about that anyways, because you were actually already in my network in terms of like referral for my clients, because that's definitely something that I fully support is seeking out a pelvic PT. And I happen to have some clients who were pregnant at the time or aiming to have children and things like that. So you were already in my network. But then earlier this year around March, I was lifting weights and I had given myself basically a diastasis recti. I felt it exactly when it happened. I had never felt an abdominal tear quite like that. In the process, I also had given myself a ventral hernia. And fortunately, I have a history of having hernias in the past, so it wasn't anything alarming. I mean, well, let me take that back. It was alarming.
Fortunately,
It was
fortunately, this
very,
wasn't my first rodeo.
yeah. Fortunately, this wasn't my first hernia, but this was my first ventral hernia. Because umbilical hernias, like, I think in the hierarchy of like pain, ventral is definitely the most painful hernia I've ever had in my life. Umbilical, is questionable, but like inguinals, I've had another hernia for years, ever since I was like in my early 20s. So I had kind of put that off. I was trying to put off surgery just because abdominal surgery, I wasn't really keen on that. And I had a couple of other strange injuries, just random injuries. And I thought, maybe a lot of this is interconnected with my low back pain, things like that. So I sought out you. I messaged you, and basically, I still remember the conversation. Like, is it okay if I still see you, even though you're in my network and we're kind of friends? Like, is this okay? Because
Isn't
I
it
was
funny though?
perfectly fine.
Oh yeah,
Yeah.
I was also fine, but we had never met in person.
No.
We've been like circling each other, like planets in a solar system
Yeah.
for at least a year. I think
Totally.
probably closer to a year and a half. Had never met in
Hmm.
person, and so we're like, I don't really know like what the move here is.
Yeah, and I'm like, I'm okay. I mean, it's just my pelvis, but keep in mind, there are things that, as like I was very forthcoming with you. Like, it's fine. Like, I don't mind personally pelvic exams. And they're not my favorite thing in the world. I will be very honest with you. Who on earth likes the stirrups or anything like that? Which we will talk about how your setup is, because your setup is fantastic. But it was also one of those things where I was just, I have not had any sexual trauma in my life or anything like that. So I didn't have that concern going into it. Plus, I knew from you and social media and other interactions and my actual PT that I see for my shoulder and things like that, he speaks the world of you. And, so I knew that you were already the best in the Denver area, or one of the best in the Denver area. And it was it was kind of a no-brainer. It was just a matter of comfort level. So we definitely cleared that up with conversation. Like, is it okay? Because I'm gonna want a pelvic exam,
Yeah.
like, but it was fine.
Yeah.
You made it very comfortable, and I knew that your bedside manner was going to be stellar. And the clients that I have that I've sent your way, I know have absolutely loved you, and I've loved the mirrors, the mirrors that you gift. Which we
They're
can.
from Awakening Boutique. I'll tag them because they're the best. They're a sexual
Oh,
store in
excellent.
Denver, and like they're amazing.
Yeah, they're fantastic, and I've gotten text of the mirrors. But they're fantastic. So yeah, that was my story. I just wanted to get clarity because I was in a place where my hernia wasn't hurting anymore. Thank goodness. That took about 6 months, and I wanted to start lifting again. I had missed barbell, and it was near the end of mountain bike season, more or less, especially here in Denver because it started to snow and things like that. So I wanted to get back in the gym, and I was really getting hungry to lift again. And I just needed someone to say, Jen, it's okay. Stop panicking. I don't remember exactly what you told me, but you're like, you're fine.
I think it was a little bit more medical and hopefully
It
a
was.
tiny bit kinder. No
Yes,
guarantee. But so what were you not doing when you came in to see me? What were you afraid of doing?
Everything. I mean, even so, I also coach part-time in person, and there were moments where even just bending over and picking up a 15-pound plate was difficult. And I stopped putting my bike on top of my car, on my bike rack. So I would put it inside. So even picking up my bike, which isn't even that heavy, and putting it in the back, I was so conscious of everything. And I stopped working out, and somehow I was still thinking I could race and things like that. Because hey, whatever, I like the challenge, but
You're an athlete through and through.
Yeah, I do appreciate, a challenge, because I still remember like a Betty Bike Bash that I raced in June, and I had just dislocated my patella a few weeks before that. And I popped it back in, so it wasn't a big deal, but there was a stretch to the patellar ligament, so it wasn't the best situation for that particular race. So I was hungry. I was hungry to get back into the gym and into racing again. So I was really looking at 2020. I was hoping that my 40th year was going to be like a landmark year, which it was, but not in the context I was wanting.
Yeah, not the ways you expected, I don't think.
No, and I wanted to do, as silly as it sounds, and this, I wanted to do flexion exercises again because, and when I say flexion, just for those of you guys that are on the live feed that don't really know, it's just any time where you're basically bending at your hips and you're flexing your spine this way, you're flexing your abdominals this way. And as silly as it sounds, I missed doing that. I missed doing things like sit-ups, and I missed doing Turkish get-ups, and I missed doing, everything. I missed going back on the bench to do bench press and like dumbbell work. And like I couldn't do anything and that's a big part of my identity ever since I was a kid. So it was huge for me to get back into it.
Well, and listening to you talk right now is really interesting because we did not practice anything before, team. So we're just like literally doing it live. But so for you to say, yeah, I dislocated my patella, I just popped it back in, it wasn't a big deal, but like I wouldn't lift my bike to put it on top of my car, right? Though there's a little bit of a disconnect there. So that's really interesting to hear.
Yeah, it's the core. I feel like any type of injuries, like anytime I've injured my knee in the past, and this is not to belittle people who have had ACL, MCL, like any of those issues, because they hurt. But comparatively speaking, my knee versus something that was in my core, in my abdominal area, and my shoulder issues, like this, it's close to your vital organs. So you're a little bit more guarded. And you can say a little bit more about how guarded my musculature is in terms of like everything up here. I just get tight, I get tense, and it makes me a little bit more guarded. So,
well, and I think there's an element too with a hernia or things actually you can see coming out of your body. Do you mind if I talk a little bit about
Yeah. Oh God. Yeah.
Okay.
Yeah.
So after we did this and like chatted for a while and Jen told me about all of her injuries, I noticed that she just like kept playing with her stomach. Like, I don't know if you can see, but she just like kept rubbing it, just like right here, just nonstop. Yeah. And I was like, what's going on, Jen? She's like, well, it's my hernia. And I'm like, stop touching it. Like, if it's giving you anxiety, like if all you're thinking about, like clearly, she told me all these things, like she couldn't do the flexion exercises she wanted. I don't think you mentioned that you weren't putting your bike up above on your car. But you weren't doing any hanging exercises, right? I don't think you were doing any type of pull-ups, although some of that was your shoulder too. And there were just a lot of things that you were avoiding. And so we talked about that pretty extensively. I was like, I think that this like touching of the hernia thing is maybe an indicator that something's going on. Like, let's talk a little bit more about that.
Yeah.
So
Hannah the hernia.
Just the whole time.
Yep, I did.
Are you still doing that?
No, actually I'm not. Ever since seeing you, I leave Hannah the hernia alone. Yeah, it's kind of funny.
I'm very glad to hear that. I think it's probably a positive. Yes. And so we checked the hernia stuff. We looked at her we looked at your abs, and I had you lay down. You had talked about how you practice meditation, and you have done breath work in the past, and we lay you down to do some breathing, and like nothing was happening.
No, I had no abdominal involvement whatsoever. And I was like, oh my God, I've lost my belly breath, which I've noticed anyways recently, especially on the bike, because I've gotten away from it, because belly breathing didn't make the hernia feel so great. So I got away from belly breathing. And let me tell you, to change the way in which you breathe during a cardio activity, that was hard.
Yeah, for sure.
Yeah, I'm getting back into it.
That's good.
Slowly but surely.
So we ended up talking about, you need to be able to relax those muscles, because them being tight all the time can definitely contribute to some of the discomfort that you're experiencing, right? And I think I went to touch your belly, and your whole body kind of jumped. And I went to like give a little pressure, and it went nowhere. It was like a trampoline, strung real tight.
Yes, that's about right.
So then I gave you all my information about what a pelvic eval at Inclusive Care with me would look like. And so that we brought out this sweet thing right here. So just for everyone else's context, I know you know now, not that you didn't know before, I'm pretty sure you did, but you got 2 bony hip bones, pubic symphysis, to the back you got spine, tailbone, coccyx, and then in between this whole sling of muscles. So we're looking at someone who has a vulva. The yellow dot would be a clitoris, urethra, where urine comes out, vagina, where a baby could potentially come out, or you might like to put things in, and then rectum. You like that? I haven't said that before,
you can put things in the rectum too if you want, if that's your thing.
You absolutely can.
Yeah, but most of the time stuff comes out.
And so these muscles are just like any other muscles in the body. If you've ever had a headache because you are stressed and your neck is really tight, same thing can happen here. So now you're trying to put something in the vagina or rectum, potentially, and finger, toy, penis, whatever it is. And it's like someone coming up behind you and trying to give you a well-meaning massage, like with their thumb, stick your thumb in your upper trap, and you're like, oh, please don't. Like, that's very painful. Same thing can happen here. So that's not what you were experiencing, but I kind of gave you some of that information just so that you had the information and can make a decision about whether or not you wanted to actually do a pelvic exam. So when you said, yes, okay, let's do a pelvic exam, what was that like for you?
Honestly, I wish all GYNs could talk to you and consult with you, because that was, if all gynecological pelvic exams were like that, I think more people would actually get their annual or every 5-year exam. And I mean that, I really do. First of all, I will say, even though I haven't ever experienced any sexual trauma in my life, I will say that I can tell that the way you word things during the exam was very much, you asked for permission every step of the way. Like, hey, I'm going to do this. This is what it's going to feel like. Is that okay? And of course, for me, I kept saying, no, yeah, it's fine. Like, it's totally fine. But I could recognize the reasoning for it, which was very appreciative. It was great. There's no stirrups. I was able, obviously, to keep everything on up top. So I basically just, unclothed waist down. You had like a cloth, I don't know what you want to call that, like just to cover me. Yeah, there were no stirrups. Yeah, sheet. There were no stirrups, so that's a winner for people who are concerned about that. And because of that, there was no butt scoot. Yeah. We all know what the butt scoot is like when it comes to pelvic exams. So there was no butt scoot.
Yeah, someone's face is right here, and you're just like shoving your butt like very
No.
close to it. Yeah.
I saw you the entire time. Like there was a sheet over my legs, but I saw you. So there was never any type of, I mean, there were moments where you looked at my musculature and things like that, especially while I was trying to breathe. We already talked about my breath, the issues that I had with my breath.
Breathing,
but
you were definitely getting
yeah,
in. I don't know where
I was definitely getting in.
It wasn't your pelvis.
Exactly. It wasn't my pelvis or my abdominal area. So you did look at the musculature, things like that. But it was a very easy exam, you know, and I saw you the entire time. It was very much not like your typical pelvic exam. So I will say that that was definitely a level of comfort. And even though for me, I didn't really have much of an issue with comfort level with exams like this. You know, but I know that that is obviously a big piece for a lot of people. But, you know, rest assured, you asked for permission every step of the way with every process and step, which was great. And your bedside manner was fantastic. So there was a sense of ease, you know, like we conversed. It's not like we jumped right into the pelvic exam. Like we conversed, you showed me the pelvic model, we talked about everything, my huge history this past year. And there was just that level of comfort that I had with you before the actual exam. The other thing I kind of wanted to add, and we've talked about this with like our respective social media posts, you know, we both have a history of like sex education. So I just want to make that clear that, you know, people who are watching, like keep in mind that like I used to teach kids how to put condoms on, you know, with a great big dildo on a table. Like I was a sex educator ever since high school into my college years. So that, keep in mind that there is a level of comfort here with me and obviously Krystyna as well. So that's why we thought it would be perfect for us to actually talk about this.
Yeah.
So yeah. But that was how the exam went. It was great. Like it was very easy, you know. I don't really have anything else to expand upon unless you want me to expand upon anything else.
No, I think that's good. I think that's great information. I know from my perspective, the thing that I think about when I think about pelvic exams is that I have nice sheets, which is something that if you've never had a pelvic exam before, you wouldn't think about. But I was a pelvic floor PT or like patient before, and I knew the difference between like the nice sheets and the crappy sheets. So I made sure when I opened my practice that I bought a bunch of really nice sheets.
Yes.
So,
nice sheet and no speculum.
Yeah.
There's no speculum. There's none of the duck, whatever you want to call it. No speculum, no need for that. There was no discomfort whatsoever. If anything, there was just some pressure on certain points because you were testing certain muscles. And especially since I do have a history of like low back, SI joint issues with my low back, you checked everything. And also because for those of you out here, because I know some of you are mountain bikers who are logged in right now, I wanted my sits bone areas to be checked because God knows how many miles and hours we have all collectively spent on our sits bones on a bike. So it was kind of a nice like refresher, you know, or a breath of fresh air just to know that everything was good. So
yeah, and so then we got you back dressed right off the table, and we went into the gym, right, and looked at some of the stuff about how you move.
Yes.
So do you remember like what we did?
Yeah, you stared at my stomach. No, I did. So I had my sports bra on. I took off my shirt just so she could see the area. And just so people know, like the area that I had the diastasis recti was in the upper abdominal. And the ventral hernia, Hannah is like right here. She's super small though right now. And she's a lot smaller now that I'm not like playing with her. Imagine that.
Weird. That's
I know. It's kind of interesting. So you did look at me in a goblet squat. So I was holding, I believe, a kettlebell, if I'm not mistaken. And you had me go into a squat position, holding the kettlebell right here, which is good because it did engage some of the abdominal muscles. And then you did also look at me, I believe, hanging statically from a rig. Correct?
Yeah. So
pull-up bar.
Basically, I made you tell me all the things that you're afraid of doing, and then I made you do some version of them.
Yes,
and I looked at your stomach while you did it.
Yes, you even had me plank and you were underneath me, you know, just to make sure. And you're like, yeah, your diastasis, it looks good. Yeah. So that was a huge relief because it definitely was a good like 2-finger separation. So it was pretty severe when it first happened. And that was just a nice relief.
Yeah, great. So then what have you been doing since I saw you? That was different.
Working out. Everything. I give you updates occasionally. That was it that day or the day after, I believe. I did sit-ups for like the first time in, I don't even know, 7 months or so.
Yeah.
Did sit-ups. I just went light. I was trying to be smart about it. So I did like 3 sets of 10 or something like that,
That
or
was a
three
funny
sets of 5.
conversation too, right? Because you were like, I've been avoiding sit-ups, and I was like, Jen, you can do sit-ups. Like, you can just do them. And so you're
Yeah.
like, I'll just be careful. I'm like, okay, if that's gonna make you feel good, like be careful, but you can do
Yeah.
sit-ups.
Well, I have a tendency to kind of go in strong. So
Yeah.
I was like, well, let me
Fair,
not
fair.
injure myself. And
Yeah.
plus with the hernia, like I just didn't know.
Hmm.
So I went light, did like 3 sets of 5 or 10. I can't remember.
I'm
And
not shaming you for
I
going in
stopped
light.
there.
It's just funny.
No, no. Oh, it was hilarious because I was like, so do I just, and you're like, Jen, you're a coach. Like, you know what to do. You have to trust yourself. I was like, I know, I know. I just want some validation,
Yeah.
which you gave me. You gave me validation. And since then, I've increased. It's now like 3 sets of 20 to 25. I've also started to do some rotational movements, things like that are weighted and unweighted, which is fantastic. Gotten back into planking, because of course planking is the one thing that really you shouldn't be doing when you have a diastasis recti. And yeah, everything feels really good. On the bike, it doesn't even bother me at all. If anything, it's the shoulder right now on the bike.
Yeah.
But abdominally, everything's good and it feels really good. It was just nice to have that like push that everything's fine. You can go forward with the things that you enjoy.
Yeah,
So.
I think something that's important to note is that, so one, I think there are a lot of physical therapists out there and just doctors in general that are like, oh, you have issues with this thing, or like, oh, you have this diagnosis, don't do this whole list of exercises.
Mm-hmm.
On the flip side, there are people who are like, oh, just do what you've always done, like things are going to be fine. Especially when you talk about pregnancy and postpartum, people are just like, oh, well, just do what you were already doing, even though people's bodies go through huge changes. So I think it's important from my perspective to get a professional involved who sees it all the time. So I wasn't just blowing
Oh, no,
smoke,
you
right?
weren't. Yeah, you weren't at all.
I checked all the things to make sure all the things
Yeah.
were clear. And then we gave you a specific set of instructions for the things that your body could do and wasn't going to have trouble with, or wasn't an increased risk or anything like that.
Yeah, it's just a matter of more or less trusting my body,
Yeah.
because I had this, I mean, it is a pretty significant injury.
Mm-hmm.
Like abdominal tearing, it's significant. And yeah, afterwards, you just kind of feel like your body is fighting against you, and you
Mm-hmm.
just had to kind of release and trust it. And that was what's been great. And oh man, it feels so good to work out. I've been heavy deadlifting. Well, heavy. It's like 100 pounds off my previous lifting, but it's still fine. Like I'm still
Yeah.
getting there. I still feel like I'm very confident with that, and I just know that it will get better week after week. So.
Are you wearing a belt when you do that?
No, actually, I'm not. I tested it lately and it's fine. Like I feel pretty good, but I think right now, as I do start to increase the weight, probably every couple of weeks, I will actually wear my powerlifting belt.
Mm-hmm.
It's a leather belt, and it's just going to be nice for me to practice that 360 like breath that we were talking about,
Yeah.
just to have that support. So.
Yeah. I just would do it when you do that. Go ahead and try it, but then just make sure that that nothing's popping out. Like when you go to take that first,
Yeah.
fill
Yeah.
your cavity with air and just make sure everything's
so weird. Hannah's intact.
Yeah, I'm not anticipating that being a problem, but that is the thing that I would look at if you were in the office.
No, it is. And it's something that I'm definitely being conscious of. After I did do my last series of heavy deadlifts last week, I did right afterwards, like I stood up and after I dropped the barbell, and I did touch her, don't hold it against me. I did touch Hannah, the hernia, and checked, and there were no changes. What did you say?
I said, you can touch Hannah. That's
yeah,
okay. Not all the time like you were
just
doing.
not all the time.
Here's
Yeah,
my friend
exactly.
Hannah.
Yeah, here you go. Oh God.
It was nonstop. You froze. Sorry, what was that? You froze for a second.
Oh, yeah, you froze too. You were just saying it was nonstop.
Yeah.
It's so true. I didn't realize how much I was like touching her.
Yeah.
So.
Yeah. Is there anything else that you think is important for people to know about pelvic floor physical therapy, or anything else that you want to talk about, like with your own journey with injury or anything like that?
Yeah. So, first of all, I think it's really important, like you mentioned earlier, try to find a PT or pelvic floor PT that will not take you away from the things that you love necessarily, and will actually help you get back to the things that you love doing. So that's important, not somebody who's going to say you need to be bed rested. The other thing is try not to be scared. If you're starting to experience symptoms, whether that's, especially if you're a CrossFit athlete, and popular thing with CrossFit athletes that, I coach or I've seen even online over the past, 10 plus years is double unders. This is when you take the jump rope, you jump twice, or you have the jump rope pass twice underneath your feet. It's an explosive movement, and there can be some pressure in the bladder. There's the urge to pee, and some women actually do urinate while performing double unders. It happens. Don't be scared, because even though your friends are still experiencing that, or maybe, peeing a little bit during double unders, and even though it's common, doesn't necessarily mean that it's something that should be happening. So it's something to get addressed, and it's something that can be potentially, fixed with just knowing and understanding how the pelvic floor muscles work, and given exercises to actually, strengthen them, or what have you, whatever the ongoing issue is. Because I'm sure you've seen CrossFitters, so you could probably speak a little bit more to it. The other thing is, like, I'm 40, I haven't had any children. I don't plan on having any children. My partner and I are going to be childless. That's just, our choice. And
child free, right? Like,
yes, child free. Yes, we have fur children, but it's human children free. So we don't anticipate having any children. So even though we aren't going to have kids, it doesn't necessarily mean that pelvic PT is out of the question for us.
Sure.
And I think that that's kind of something that a lot of individuals tend to equate is, oh, you're pregnant, so you need to see a pelvic PT. Yes, I do highly agree with that and highly recommend it. But a lot of the times people think, well, I'm never going to have children, or I'm not going to have children, and I've not had children yet, so I shouldn't see one.
Mm-hmm.
So there is that point, just to kind of let everyone know that it is something that you should consider.
For sure. Well, and a ton of people are leaking who have never had kids, or having painful sex, or like just not having great sex in general. Yep. Maybe it's not painful, but you get burning, or like just discomfort, and like a complete lack of interest because you're not getting aroused. Like those are all things that can be muscular. That can be other things too. So I think that's a really good point. And and Kegels are also not always the answer, right? I think it's worth saying, because when you talk about strengthening the pelvic floor, people do typically think of Kegels, and sometimes that is a really important part of a program, but it's just like any other program. You have to find things that are going to work for your body and based on what you're experiencing. And I see a lot of CrossFitters who don't need to strengthen their pelvic floor right away. The issue is that they are so tight that they can't get the muscles to relax. And so they're not able to kind of accommodate and accept weight and impact. And so then it's like bringing something off of a rubber band that's too tight. And that's when people end up leaking.
Yeah. And imagine how painful sex can be, or how uncomfortable sex can be when you're that tight, Right. And I hope that people can kind of leave this conversation and future conversations that you have with other people on your channel, and just knowing that there's not anything wrong with you. You're not broken. You just might need to pay attention to certain things and do certain exercises to help counteract these things. And it shouldn't be taboo. This is something that we should try to be more open about. And I know it's something that I've told you, thanks for letting me want to be more open about sexual health, because as being a health coach, this is very important to me. Mental health, sexual health, physical health, nutritional health, things like that. That's all important to me. And it definitely falls under the sexual health, umbrella. So I think we should talk more about this.
Yeah, we definitely should. So I know, but between now and the end of the year, I'm talking a lot about painful sex. I think a lot of people just still don't realize that they're like, oh, they really do think it's normal. People think like, oh, that discomfort I have at the beginning of sex is normal, or like, oh, that discomfort I have after orgasm is normal. And it doesn't have to be that. It really impacts your desire to have sex, which can impact your relationship with your partner, can impact your relationship with yourself, your self-esteem. So like, it's good to just be on top of it. And maybe it is normal, but you're not going to necessarily know that for sure unless you see someone who can tell you that.
For sure. And of course, and this is not to negate anything that a GYN or a practitioner would tell anyone here on the live feed, is, the knee-jerk response to painful sex is, well, maybe you just need more lubrication.
Right.
That's not always the case,
Sure.
And I feel like if we can help a few people figure this out, if they are experiencing painful sex or anything like that,
let's talk about lubrication really fast about that.
Oh, because let's do it.
Okay, so I do ask people. I ask people if they're using lubricant. A lot of the time, the answer is no. Actually, very rarely do people say, yes, I've tried it and it didn't work. They will usually say, if they've tried it, they say, yes, I've tried it. It helps a little. But worth noting, vagina. So you don't want to just put it on the inside because the inside might be wet. It's the outside that's so dry. And so just make sure that you're covering like all around here. You can also put it actually on your clitoris if you feel like clitoral stimulation is really intense. That can be really helpful. And so doing that from the beginning can kind of decrease the body's like the discomfort that people experience at the beginning of sex, which then makes their muscles tighten because it's trying to protect. So that's just something that's worth noting, I think.
Nice. A little aside. Is there a lubricant that is recommended? You know, I'm sure.
Oh man, I could talk about lubes for a long time.
Okay.
I use slippery stuff.
Okay.
That's what I use in my office. It doesn't have parabens in it, doesn't have glycerin in it. It keeps things wet for a pretty long time, slippery, and it's like a little bit plushy, which can be kind of nice. And it's actually pretty cheap. So you can get it on Amazon for not that much money. If you want something that's a little bit nice, like it just depends on what your preference is, really. Yeah. I think like broad-based, easy recommendation is slippery stuff because it's water-based, very much like your body. It doesn't have the crap in it that you're worried about. Pretty cheap. So yeah, I like all of those things.
Yeah, definitely no oil-based.
Yeah, definitely not if you're using condoms. And yeah, there are a lot, like I said, I could talk about loops for a long time. But I was actually just talking to a patient of mine who had his post-op after vaginoplasty, and she's using slippery stuff, and she was talking about how like it stays slippery for a really long time, doesn't have any smell, doesn't have any taste, and she really likes it. So
nice. Okay.
Good for like a lot of different types of people.
Okay, perfect.
Yeah.
That's good.
Yeah.
I haven't had to, well, I won't say that. Never mind. Just in case never mind. My wife logs in. I was going to say, I haven't had to do that in a long time. I haven't had to worry about lube in a long time. All right, anything else?
Someone was like, hey, Krystyna, are you going to start a podcast? I was like, no one should give me a microphone. If I have a microphone for that long, there are no promises for what I'm going to say. I absolutely cannot.
I know. But hey, the good news, well, we haven't cursed yet, which is pretty impressive.
Yeah.
I know. I know. It's
really
very surprising. Yeah, we really are.
When I talk at events, so the very first event I ever spoke at, I like wrote everything down, and someone came and gave me the feedback like, oh, your speech was really great, but you really stuck to your notes. And I said, just straight up, I was like, I get very nervous, and when I'm nervous, my mouth runs so much faster than my brain, and I for sure was going to fuck it up. See, there it is.
Yeah.
That's what I said.
Yeah, see, there you go. There, we had to drop an F-bomb.
Yeah, it had to happen.
This is a little.
It was a direct quote from what I said in the past, so it needed.
That's true. That's true. It's warranted.
Posterity.
Hey, my parents from New Jersey, and my dad was a Navy. I don't know what you want to call him, my seaman. And, that's perfect. I was trying to find another word, but then I was like, oh, it's fine. He was a seaman. So yeah, cursing galore. Yeah, it's fine. It's adjectives. Yeah. I'm trying to think. So we did have a question. I actually had one of my followers ask a question about the urge to urinate in the middle of the evening.
Oh yeah.
So while sleeping.
Right.
Do you want to expand on this?
Sure. So if it happens only one time, if you have to get up and pee in the middle of the night, one time is actually totally physiologically normal. That might just happen, especially if you're drinking water late into the evening or coffee or bladder irritants. So anything that is carbonated, has sugar, has fake sugar. So basically anything except water. Those things can make you have to get up and pee. If you get up more than one time per night, it could be an issue with your pelvic floor muscles, or kind of the peeing reflex, sort of. So you can actually retrain that in some pretty specific ways. So if it's bothersome, and you're doing it more than once a night, then that's something you could see somebody for. If you're over 65, you get two times per night.
Got it. Interesting. Okay, that's fascinating. Good to know.
Yeah.
All right. I know I usually tell my clients to, since one of their first habits with my clients is to hydrate, make sure that we're hydrated properly. The biggest thing that I say to them is please cut it off like a couple hours before bed, because that's just going to make it a little bit more pleasant. Well, sleep time.
Especially if you're ramping up water intake, and if you're doing it, make sure you're trying to do it through small amounts throughout the day as opposed to all of it at once. Because if you drink a bunch of water all at one time, your bladder expands really fast, triggers the reflex, and then it wants to contract, and that's what's going to make you have to pee.
Nice. Okay. Good. Did you get any questions?
I got questions. I got some really interesting questions, actually. I got one about someone who is self-cathing, so they're unable to urinate alone, and so they use a device to help them do that. And tips on being able to insert the catheter without, they don't have any sensation. So kind of how to relax your pelvic floor muscles and how to know that you're doing that if you can't feel it. My response was to take really big deep breaths into your lower abdomen, just like I had you do, because even if you can't necessarily feel it, and a lot of my clients who have full sensation just can't necessarily they're not always aware of that, especially right at the beginning. Expanding those lower abdominal muscles can help those pelvic floor muscles relax. So
nice.
I talked about that. I had someone ask me about, they have Ehlers-Danlos syndrome, so EDS, and they were asking about positions to have sex in that aren't damaging or aren't harmful for their hips. So they had experienced hip dislocations in the past. So we talked a little bit about different positions they could try. We ultimately settled on possibly doing it lying down on their side. So maybe you'll know, Jen, actually, someone else asked me for wheelchair accessible things to visit in Colorado. Any ideas?
Well, there are, it's funny because I've actually had this conversation with some other individuals who are wheelchair bound, because my mom has MS. So she's not necessarily wheelchair bound, but she does have limited mobility. You know, there are going to be trails that you can access, but only certain distances, and there is a website for it. I cannot recall what the website is, but if you look up, like, I think it's, if you Google like wheelchair accessible trails Colorado or something like that, there aren't really necessarily going to be full trails unless you get onto a greenway, you know, which we have a lot of greenways here. You know, there's going to be obviously Platte River, there's going to be Cherry Creek.
Oh, she clearly got kicked off. I don't know. We'll give her a second and see if she comes back on. But otherwise, I think that was mostly it anyway. So thank you very much for joining us. And if you have any questions, oh, wait, she's back. Hello. Maybe.
Instagram. Yeah, it just kicked me off. I guess it gives me like an hour to join someone, or 30 minutes or something like that.
Yeah.
But yeah, Google wheelchair accessible trails, and I believe that there's going to be a whole list of things, but look at the greenways.
Okay.
That's going to be the big thing. I know that Denver does have an older downtown, like a lot of cities, larger cities here in the US. So a lot of the things aren't going to be ADA compliant. But if in terms of things that they're wanting to change downtown, like the intersections are a little bit better for wheelchairs now.
Good.
If they go business to, I know, finally, right? They just did our neighborhood actually this past year, so that was good. But you know, did he or she ask specifically for what they wanted to do? Like, was it more?
I think they were looking at Garden of the Gods, part of that.
Oh yeah, Garden of the Gods is paved, so that would be a great place if they wanted to go down to the springs. Yeah, that would be my only bet right now. Yeah, I was just trying to find the greenways and things like that. So yeah,
great.
All right. Good.
Really nice talking to you. And
yeah, likewise.
Okay, we're back. It was really nice talking to you, and thanks for doing this with me. And if anyone has any questions or any needs any tips for anything, I think we're both pretty approachable people.
Yeah, approachable, blunt, willing to offer advice and guidance.
Yes, exactly. All right, thanks, Jen.
Thanks, Krystyna. I'll see you later.
Yep, bye.